Welcome viewers, in today's class we are going to see about autoimmune diseases. What is meant by autoimmunity? Auto means self. So automatically your immunity is going to act against your self antigens. So this is the literal meaning, but contextual meaning has a good definition. Autoimmunity is defined as the immune responses of an organism against its own healthy cells and tissues. Any disease that results from an inappropriate immune response is termed as an autoimmune disease. So, in the later 19th century, it was believed that the immune system was unable to react against body's own tissues. Paul Ehrlich in 20th century proposed the concept of horror autotoxicus. Normally, the immune system can recognize differences between foreign shells and self cell, that is the recognition ability of immune system. But if the recognition fails due to intrinsic or extrinsic factor, the immune system produces autoantibodies to target our own cells in the body. Autoantibodies are directed against one or more of own proteins, that is self antigens of the individual's own body tissue. Some autoimmune diseases target only one organ, example type 1 diabetes, in which autoantibodies damage the pancreas, whereas other diseases like lupus, in which autoantibodies target whole body non-specifically. So there are some list of diseases with typical manifestations we are going to see here. First disease is type 1 diabetes mellitus. The pancreas produces the hormone insulin, which helps in regulating the blood sugar level. In type 1 diabetes mellitus, the immune system attacks and destroys the beta cells in the islets of Langerhans and pancreas. So those cells are producing the insulin. So high blood sugar may result in that, and it can damage blood vessels as well as organs like heart, kidney, eyes and nerves wherever high glucose is supplied. Second disease is rheumatoid arthritis. In rheumatoid arthritis, the immune system attacks the joints and cartilaginous tissue. So it is a chronic inflammatory disorder. So rheumatoid arthritis attack joints and causes redness, warmth, soreness and stiffness in the joint. We call it as inflammatory response. Inflammatory response is identified by four main factors: edema, erythema, heat and pain. So as a result, you are seeing, as a result of the autoantibodies that are directed against the joint tissue, we can have the characteristic symptom of redness, warmth, soreness, stiffness as a result of inflammatory response. So unlike osteoarthritis, where joint inflammation results from cartilage degeneration, which affects people as they get older, rheumatoid arthritis can start as early as the age of 30. Here, autoantibodies are directed against the cartilaginous tissue. It's not like osteoarthritis. And there is psoriatic arthritis. Psoriasis causes skin cells to multiply quickly. The extra cells build up above and form red scaly patches called scales or plaques on the skin. About 30% of the people with psoriasis may develop swelling, stiffness, pain in the joints. So this form of disease is called psoriatic arthritis. Here the cell division is promoted with the help of autoimmune factors. So another disease called multiple sclerosis. The name suggests it's going to have multiple discomforts. So multiple sclerosis damages the myelin sheath in the neuron, the protective coating that surrounds the nerve cell. So damage to the myelin sheath affects the transmission of signals between your brain and body. Damage to myelin sheath can lead to symptoms like numbness, weakness, balance issues and trouble walking. About 50% of the people with multiple sclerosis need help walking within 15 years after getting the disease. Fifth disease is systemic lupus erythematosus, simply called lupus. So doctors in 1800s first described lupus as a skin disease because of the rashes which are characteristic. It actually affects many organs including joints, kidney, brain and heart. Joint pain, fatigue means tiredness, and rashes are the most common symptoms in case of lupus. And the sixth one is inflammatory bowel disease. Inflammatory bowel disease is a term used to describe conditions that cause inflammation in the inner linings of the intestine. So each type of inflammatory bowel disease affects a different various parts of the gastrointestinal tracts. So based on that, we categorize them into two categories. One is called Crohn's disease, where inflammation can occur in any part of the gastrointestinal tract from mouth to the anus. And second one is ulcerative colitis, affects only the inner lining of large intestine, otherwise called colon and rectum. And seventh disease is Addison's disease. Addison's disease affect the adrenal gland. We all know that adrenal gland play a major role. It is situated above the kidney and play a major role in producing the hormone called cortisol. Cortisol helps in glucose uptake in our body, and aldosterone and various other flight, fright and phytohormones are also produced by adrenal gland. But this disease affects the gland. Antibodies are directed against adrenal glands. So reduced amounts of hormone can affect the way the body uses and stores the carbohydrates as well as other sugars. So symptoms like weakness, fatigue, weight loss and low blood glucose level is also seen. The eighth disease is Graves' disease. So Graves' disease attacks the thyroid gland in the neck, causing it to produce too much of its hormone. So thyroid hormones, we know T3, T4 and stimulating hormone is TSH. So as a result of certain antibodies that goes and binds to the receptors of the thyroid stimulating hormone, more amount of thyroid hormone is produced and it is going to circulate in the blood. So thyroid hormone control the body's energy metabolism. We call it as basal metabolic rate. Because these antibodies activate the production of more amount of thyroid hormones from the gland. Having too much of these hormones may increase your body's activity and causing symptoms like nervousness, then fast heartbeat, heat intolerance and weight loss. One common symptom of this disease is bulging of the eyes. This is the characteristic symptoms. One can identify the patient with Graves' disease with a symptom called exothalomas. So exothalomas, exo means something coming out and thalamus means eyes. So bulging of the eyes and eyeballs outside. So it affects up to 50% of the people with Graves' disease. We can see this characteristic symptom of exothalamus. Early symptoms include fatigue, tiredness, muscle pain, otherwise called myalgia, swelling and redness due to inflammatory reaction, and low-grade fever. There is trouble in concentrating, trouble in cognitive behavior, hair loss, increase in the number of tillings in the hands and feet, skin rashes. In diabetes 1, we have extreme thirst, weight loss and fatigue. Inflammatory bowel disease, there is belly pain, bloating, which means gas accumulation in the stomach, and diarrhea. Diagnosis: we do not have a single diagnostic method. There are a combination of tests are required to assess the symptoms and to diagnose the autoimmune diseases. We have a test called antinuclear antibody test. Is the first test that doctors ever use when symptoms of autoimmune diseases are suggestive. A positive test means you are likely to have one of these diseases, but this antinuclear antibody test is non-specific. It does not characterize, it does not specifically identify any one of the disease. It does not distinguish the type of disease, I mean. And treatment cannot cure the autoimmune disease because it is your own body's immunity attacking your cells. So treatments are given to suppress the symptoms and to suppress the illness. So treatment can just control the overreactive immune response and bring down the inflammatory response. So drugs used to treat these conditions include non-steroidal anti-inflammatory drugs like ibuprofen and naproxen, and some other immunosuppressive steroidal drugs, example dexamethasone, can be given. Treatments are also available to just suppress the inflammatory response. Pain, swelling, fatigue, and skin rashes. So eating a well-balanced diet and getting your regular exercise can help you feel better from autoimmune diseases. Thank you.